Welcome back everyone to Survive Outdoors. Dan Williams here. Today I'm going to do a case study that I had 3 years ago. Before I jump into that about West Nile, I want to explain to you part of the reason why I do this. I'm doing this because if I can get you guys to be less anxious, less concerned about going out there and getting one of these diseases that in the last 10 years the media has barraged us with all kinds of fear. So I can give you the facts, then that would be awesome. And that's the goal here. Be prudent, but know the facts. So this case study, as a mosquito just buzzes around me, is a 57-year-old white male that came into our clinic in July 2019. And there's those times when you walk into a room and you know immediately someone's sick. And this was one of those times. So I walked in the room and he had headache, fever, he was fatigued, he was photophobic, which means he was very sensitive to light, and he really looked ill. And he looked like he had influenza, but this is in the middle of July and that's very rare. His history, he has a history of hypertension, he has a history of surgery 5 years ago, he had fusion on his lower back. Other than that, his history was insignificant. He has mild nausea, no vomiting, no diarrhea. His blood pressure was 152/94, his pulse was 120, his respiratory rate was 18, his pulse ox was 98%, and his temperature was 99.2, which did not make sense with his pulse. And if you go back to the video on medical kits, I speak about that for every degree your temperature goes up, your pulse rate on average will go up about 10 beats per minute. So I redid his temperature, and his temperature was 101.8. That jives more with his tachycardia at 120. So now what? So we did a chest x-ray to see if he had pneumonia. He did not. We did a urinalysis, which was normal. We checked his AccuCheck, his sugars were fine. So what do we have? We also did an influenza test, and just to see, because here we got a guy with body aches, high fever, looks like crap, feels short of breath, even though his pulse ox was 98%. So now what comes into play is we have to do the investigative work. And I really enjoy infectious disease and zoonosis, because zoonosis is diseases that are transmitted by the critters out there in the outdoors. So I started asking him, look, I need to know where you were 7 days ago, 2 weeks ago, 3 weeks ago, any vacations, camping, fishing, hunting, anything like that. And sure enough, around 6 to 7 days ago, him and his wife went to northern Minnesota, and he was going to do some fishing up there. Spent about 3 days, and one of the reasons they returned early, because the mosquitoes were so bad. Okay, bingo. There we have it. Does this guy have Zika? Does he have West Nile? You know, was not sure at that time, but everything started to fit when you get a good history, because the incubation period for West Nile virus is 2 to 6 days, but it can be up to 14 days. Most West Nile patients are asymptomatic. Only one in about 100, thank you. Hey, there he is, honking. Only about 1 in 150 basically gets sick enough where they have to be hospitalized. About less than 1% get very sick with encephalitis, and that is very, very low, obviously. And about 10% of that less than 1% can basically pass away from this illness. They can get a myocarditis, inflammation of the heart, and they can get an encephalitis, inflammation of the brain. The differential diagnosis on this guy would be St. Louis encephalitis, mosquito-borne vector, or TBRF, tick-borne relapsing fever, which we're going to address in an upcoming video. So we sent him to the hospital. I talked to the doc and the ED. They did a CSF on him, cerebral spinal fluid, and they did an IgM-IgG antibody, and sure enough, his West Nile virus came back positive for IgM antibody. The IgM antibody will stay in, usually it'll start being positive around 7 days, 8 days after illness. So here we have it, West Nile virus. very rare condition. The vast majority of people that get bit with the West Nile mosquito will be totally asymptomatic, will not even have to be admitted at all. So if you like this video and you felt it was informative, you feel it helped you, if you feel more confident, give me a thumbs up, press the subscribe button, mash that sucker down. In the meantime, keep your eyes on the horizon, your face to the wind, stay safe.